Welcome and thank you for joining us once again for a weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and also joining us as every week is our Health Officer, Dr. Travis Gales, Dr. Earl Stoddard, who is the Director of the Office of Emergency Management and Homeland Security. And today we have as a guest, Maryland Delegate Eric Lutke, also joining us. Reporters, all of you should already have permission to record. And if you do not, please use the chat to request it. And with that, Mr. County Executive.
Hi, so welcome everybody again to the briefing. And I'll start on a note that, today Montgomery County Public Schools start their graduations. They will be in person. I remember my own graduation from Constitution Hall down in DC in 1967 from Einstein. And I remember what an exciting day that was. So I want to congratulate all the high school graduates and their families. And I know how important this is, and I know how nice it is to be able to do this back in person again. So that's a really good thing and a good sign. Speaking of good signs, Montgomery County, our positivity rate today was 0.94, and the case rate was 2.6 cases per 100,000. Yesterday, we saw 5 new cases. That is a remarkable turnabout. And 58% of our residents have been vaccinated with both doses of Pfizer or Moderna, or had a single dose of J&J according to CDC data. We should cross the 75% mark for adults over the age of 18 having both doses very soon, and 89% for the 65 plus population have already received both doses. Young adult vaccination rates continue to lag, and this is where we're continuing to focus our efforts now. And last Friday, the 28th, we aligned with the state health regulations that were in effect at that time. Openings are beginning to occur in the county government. Yesterday, our library system opened 6 of its branch buildings to the public for the first time. I was at the Silver Spring branch. It was really great to see people inside and on the computers. The staff was, excited to be doing their jobs in the full sense of the word now. And people were excited to be in the library. Our senior centers are also reopening. Holiday Park Senior Center, located on Ferrara Drive in Silver Spring, and Damascus Senior Center, located on Main Street in Damascus, will open on Monday the 14th. The Recreation Department provides 7 senior centers in the county. The Wheaton and White Oak Senior Centers will continue to be COVID-19 vaccination sites for now. And the Long Branch Senior Center will continue to be a full-time homeless shelter. The Margaret Schweinhaut and North Potomac Senior Centers are providing summer programming for hundreds of youth until the full reopening in August. And additionally, our permitting office will return in-person appointments on Monday, June 14th. Moving forward, as Memorial Weekend both marked our reopening and the unofficial start of summer, just yesterday afternoon, I was in Silver Spring and I visited Truebill, which is a company that came here about 2 years ago from San Francisco. And I was there to celebrate with them the $45 million in additional venture capital funding that they achieved, which is leading them to increase their staff. And so they continue to grow. Montgomery County has been a good home to them. And they're really happy with their location and what they're able to do now. So they're going to keep adding, growing, and putting more jobs in. And as we pivot the COVID-19 response to COVID recovery, my administration is going to be focused on job growth and economic development throughout Montgomery County. You'll be hearing more. We've talked about White Flint. We will elaborate further on that. And there are some other good news stories that we'll be bringing to you soon. Last week, we concluded our phase 3 round of business grant applications. We received 116 new applicants, 55% we believe will be approved for $10,000 grants. Over 750 previous grant recipients from phases 1 and 2 should also receive an additional $5,000. And thus far, we've provided about $80 million in business grants. I'm really proud of the work that this government has done, and we're doing everything in our power to help Montgomery County's families, businesses, and workers who are most in need. We continue to encourage residents who need assistance with rental assistance to contact us. Residents can go to our website or simply call 311 for more details. So far, we've provided $115 million in rental assistance, but we recognize the need is still greater than that, and we are looking for what else we'll be able to do. By Labor Day, Montgomery County will provide $100 million in assistance to individuals and families. And for in our FY22 budget, we added $25 million to the Working Families Income Supplement to supplement the state's tax refund for low-income families and expand these funds to undocumented workers who have individual taxpayer ID numbers instead of Social Security numbers. We're the only county in the region that's providing this type of assistance. Montgomery County government's in a position to help so many of our residents because of the successful efforts of both our state and federal delegation to provide us with the financial support that is needed to do this. I'm very pleased the Majority Leader of the Maryland House of Delegates, Delegate Eric Lutke from the 16th District, is joining me today at this media briefing. I also want to just thank him and thank all of our state delegates and senators for the incredible help and partnership during the pandemic. This was not easy for anybody. They had a full plate they had to deal with, but their focus on what we thought were really important issues, I think, led to a very successful legislative session despite all the challenges. From assisting residents to navigate the frustrations of the state's unemployment process, I can't think of how many people we had to send to state delegate offices to help navigate that process and to help support our pandemic operations. Leader Lutke and his colleagues have just been incredible partners in this, and their work on the pandemic has been very much appreciated, as well as their historic General Assembly session with policy progress made on things like police reform, social justice, as well as efforts toward combating climate change and standing with our immigrant communities. There's a lot to be proud of. There's a lot that was accomplished. And so I just want to thank him and the rest of the delegates and senators. Our Avery Road Treatment Center, which is replacing the overworn and tired building that was there before. It's going to continue to be the focus for our recovery for residents, specifically their folks with mental health issues, and we know there's more of that that's attributed to the pandemic. This Friday, we'll be cutting the ribbon on Avery Road. A total of 108 county residents died of opioid-related doses in 2020. That's an increase of 26 from 2019. This is a state and national reality. COVID has been hard on people. And for people who have challenges in negotiating everyday life, this only made it harder. This new $15 million center has 64 beds, has drug and alcohol treatment facility, and has been under construction since the fall of 2018. And the opening of the center is welcome and needed news for the county and will expand our capacity to treat people. This is also the first week of Pride Month, and in Montgomery County, we recognize Pride Month. Next Monday, I will join Councilmember Glass as we will raise the Pride flag at the Executive Office building that will fly this month. Montgomery County is an inclusionary community and that has welcomed and embraced our LGBTQ plus community long before the rest of the nation or the world. LGBTQ plus residents of Montgomery County serve as elected officials, public service professionals in every branch of our government and our state delegation. This community is woven with the fabric of who we are and will forever be. And that's part of our history and part of our heritage as we move forward. I wish to thank all of our LGBTQ community members and to wish them a joyous Pride Month celebration and look forward to this month's events that will honor the contributions made to our history and to our community while we rededicate ourselves to creating a more equitable future for generations to come. We have rising concerns of anti-Semitism in the community. There's been just an increase in anti-Semitic acts around the country. And, we wanted to be sure that folks in the Jewish community know that we stand with them. We stand against anti-Semitism. Anti-Semitic language, threats, and actions have no place in Montgomery County, our state, and throughout this nation. And similar to the violence and vitriol against our Asian American and Pacific Islander communities, the Jewish community of Montgomery County understandably is alarmed by this rise in incidents. And that is something that we all, I think, understand all too well. As somebody who grew up and got to experience it firsthand, it is unfortunate that in my lifetime it has not gone away, and I've been around for a while. While the Montgomery County Police Department has not had reports of specific incidents, they are vigilantly monitoring and increasing patrols around synagogues as well as Jewish businesses and communities. And we continue to ask that if anybody experiences any form of hate or threats because of their racial, religious, ethnic, gender, and/or sexual orientation, that they report these incidents to law enforcement. We take this seriously, and it will not be suppressed unless people report these incidents, so we can provide you and the community the support you need. And if you believe a hate bias crime has occurred, you can please call 301-279-8000 or dial in an emergency at 911 to report an incident to the Montgomery County Police immediately. Lastly, I want to comment about the state opting out of unemployment. And I'm so glad that Delegate Lutke is joining us today to address this disappointing news from Maryland that it will end the federal enhancement of unemployment benefits next month. I don't know how many people know this, but the maximum unemployment benefit in Maryland is about $434 a week. And at the start of COVID, the average payment was about $374. So that payment didn't even replace the income most people made from any of their jobs. So already unemployment was unequal to the task of sustaining people. The additional money coming from the federal government, and this is not state money, this is federal money. This additional money helps make it possible for people to weather periods of unemployment and to act frankly, to more adequately provide support during periods of unemployment. Unemployment shouldn't be a period where if you've been laid off or there aren't jobs, that you have to suffer severe economic deprivation. I'm a firm believer that unemployment benefits should be increased in general. But this decision by the governor is premature. He's heard, as we've heard, that there are employers who are saying that they can't find workers to come back. The truth is, if you just walk around Montgomery County or any place else around the state, and frankly, the country, you'll see lots of shuttered businesses. And we've been saying on a number of fronts from the beginning that when the pandemic is largely over, it's going to take a while for businesses to reopen. There's some businesses that are never going to reopen, and those jobs are effectively lost forever. Other businesses will have delayed reopenings, they'll have partial reopenings, and will not, and are not likely to bring back their full staff for when they were fully doing business. So the reopening is going to be gradual. And taking away this benefit from people who are unemployed for no other reason than the fact that COVID caused their jobs to vanish is really unjust. And there have to be better ways to deal with this. But they certainly shouldn't have pulled the plug on the unemployment compensation and the pandemic unemployment benefit. And that benefit for gig workers and others is really essential because they normally don't even qualify for unemployment. So think about, with people not going to work and people not going out the way they used to, the use of Uber and Lyft and other ride-hailing services is greatly reduced because we're not hauling people the way we were hauling people around before. So these folks not only have a greatly reduced number of customers, they have no unemployment whatsoever. And pulling that plug on these folks is just, I think, just wrong. We should wait this out and get another 3 to 6 months down the road. And as jobs start coming back and things start reopening, then it makes sense to make some changes. But this is not the right time for these changes. And it's hard to accept because this is a benefit that comes from the American Rescue Plan. The benefit continues through September 6th. and it's federal money. So again, this is 2 months of money that doesn't come from the state, but comes from the federal government, and we're opting out of it. It just does not make sense, and it's certainly not fair. Our economy, like I said, is going to take a while to recover. We're no different than the rest of the DMV. Everybody's struggling with the same thing. And the $300 a week doesn't go far, but it's certainly a worthwhile supplement to the base unemployment check that people get. So I'm asking the governor to reconsider this decision. And I know other leaders around the state feel the same way. And because of Delegate Lukey's leadership on this and other social justice issues, I wanted him to join us today. And so with that, we're going to hear from updates for Dr. Gales and Dr. Stoddard, and then hear from Delegate Lukey, or unless we want to reverse the order. But I'm happy he's joining us, and looking forward to his thoughts on this.
Thank you, Mr. County Executive. Let's move forward with you, Dr. Gales and Dr. Stoddard, and then we'll hear from you, Delegate Lukey.
Good afternoon, everyone, and happy Wednesday. I do not have a ton of updates. Just to keep it brief, the county executive referenced where we stand in terms of community transmission. We continue to see low levels of transmission, and we will continue to monitor that, particularly after things opened up to full capacity on last Friday. As you recall, that was driven in large part due to our increase in the percentage of our residents who've been vaccinated. We are now just shy of, per the CDC, we're I think at about 58.5% of our residents having been fully vaccinated, meaning they received 2 doses or at least one dose of the Johnson & Johnson. And we are approaching 70% of all of our residents having received at least 1 dose. I'd like to highlight within that is when you break it down by age, we are over 85% of our residents 65 and up who've been vaccinated. Which is amazing. Again, that population was the most vulnerable throughout the pandemic. And we continue to make inroads and double up our efforts to get our younger people covered with the vaccine as well, particularly those 21 to 35, where we've seen lower rates of uptake so far. I would like to also pivot to something as it's non-COVID related, but also influenced by COVID to some degree. We know that as things open up and the summer comes around and the weather improves, that people are going to be a lot more active. And so I just want to remind you to be safe in those activities. Stay hydrated, drink lots of fluids. When you're out in the sun, make sure that you use some type of sunscreen and you cover your skin. And when you are, particularly as it relates to pools, as pools are opening up, make sure to follow good safety procedures and protocols to make sure that you and your family members and anyone else in those environments stay safe and we don't have any fatalities or complications. Thank you again for your time. I will stop there. Happy to answer any questions you all may have.
Thank you, Dr. Gales. Dr. Stoddard.
Good afternoon. I only have 2 things to update on. Got some questions about the mass vaccination site at Montgomery College, Germantown. While we do not have a closeout date for that, we will be having a meeting tomorrow with the core partners to discuss sort of what our timeline will be. What that will likely entail is that at a certain point over the coming weeks, we will transition to using more of Johnson & Johnson to allow us to just do the single dose and not have that 3 to 4 week later commitment for the second dose for a Moderna or Pfizer vaccine. Once we have a firm plan or strategy for the wind down of that site, we will let people know. We want to make sure that we're reviewing the data and we're not closing it too prematurely. The other thing I wanted to talk about is that we are working with the Soccerplex, the Maryland Youth Soccer Association, MYSA. We are working with them to try and offer a clinic this Saturday. Either us or FEMA or a partnership thereof will be likely setting up a vaccine effort at the site of the stadium on Saturday, but we're working out the final details on that. Hopefully be able to clarify everything, the exact details, times, and all that kind of stuff by the end of the day today, if not early tomorrow, just to offer that opportunity, as Dr. Gill said, to make the vaccine available to more of our young people and their parents. So that's all I have for today.
Thank you, Dr. Stoddard. Delegate Lutke.
Thank you very much, Lorna, and thank you to the county executive for inviting me to join you and for the partnership we've had with him and the entire county, and in particular Dr. Gales and Dr. Stoddard, who've been keeping us informed in the delegation in addition to keeping you informed in the press. Look, the governor's decision about unemployment insurance is both cruel and precipitous. There are approximately 15,000 families in Maryland that are using these expanded unemployment benefits right now to put food on the table and keep a roof over their heads. And the governor's taking that away from them unnecessarily. The county executive pointed out, this is free money. This is money that comes from the federal government without a county match, without a state match. It's money that these families spend almost immediately in the economy. So it's going to have the effect of taking tens, if not hundreds of millions of dollars of economic stimulus out of the Maryland economy over the next few months, just as we're recovering from COVID. And the governor's claim that this will force people back to work, first of all, is empirically untrue. It's simply not true that people have been staying out of the workforce because of the expanded unemployment benefits. How do I know that? Because JP Morgan tells me so. They released a study just recently which showed that the expanded unemployment benefits we've had during the pandemic has not resulted in people staying out of the workforce. But even if it were true, the idea that we're going to starve people into submission to take low-wage jobs is frankly unacceptable. So I think I joined the county executive, and I think the entire Montgomery County delegation joins the county executive in calling on the governor to reverse this decision, to prioritize Maryland families and frankly not prioritize GOP presidential primary politics. I'd also mention to members of the press that I believe Chairman Davis of the Economic Matters Committee is going to have a statement to share later today for the press about his reaction to all of this.
Thank you, Delegate. We're going to get started with the Q&A portion of this presentation, and the first set of questions come from Rebecca Tan from the Washington Post. Hello, Rebecca. Good afternoon.
Hi, thank you. I hope it's all right. My internet access is not being the best today. I'm sorry if this was already addressed, but I've seen in the dashboard that even though cases are going down, that there was a sort of bump of cases on May 30th with 97 new infections. And then on May 27th, there were 58 deaths that were reported. I'm wondering if either Dr. Gales or Dr. Stoddard can, explain why there were these sudden sort of spikes here.
Thank you, Rebecca, for your question. So I think part of the challenge is recently over the last 2 weeks, we've had some issues with the data being reported from the state in terms of how it's broken down. As a matter of fact, this morning, even in the numbers that show the state having 65 cases overall and us having 5, it was reported that that was missing information from at least 4 of the labs. So I think that in large part, this is due to some delays in reporting and how that information is being sequenced and shared. But none of the information that we have based upon the statistics and information that we've had looking at the different sites suggests that there is something more to that in terms of an isolated outbreak and so forth. But obviously, we will continue to monitor that to see if anything pops up. And I think we've shown over the last year, we try to be proactive and get ahead of things if we notice anything trending in the wrong direction.
Got it. And related question, now that cases are sort of winding down, even with the 7-day averages, are there trickle down, health impacts, ramifications, or fallout that are starting to emerge that are maybe not, coronavirus cases, but just other types of health impacts?
Well, I think the next few months are going to be very interesting as time moves forward and we start to get a better understanding if and what those potential secondary consequences of those who have had COVID in the past, what they look like, and what potential long-term effects of COVID-19 cases may be. I think one of the other non-specifically COVID-related issues, but certainly influenced by the last year and a half, We'll continue to look and see how a lot of those conditions that we knew that there were disparate gaps that existed before COVID that unfortunately played out in COVID. We'll have to continue to watch to see how those respond as well, to see if those gaps have increased or if there's been any shift in that. And I think we're going to have some, serious ongoing conversations about what it means to have access to care in a post-COVID environment. What do people have access to when we talk about access to care, as well as looking at utilization patterns in terms of individuals who may have had chronic diseases or chronic conditions. Are they coming back to their primary care offices? Are they going to the emergency rooms to utilize care? Where are they being seen? And when they do show up to care in those different venues, what is their status of health? Are they showing up in acute crisis? Are they showing up in good health, or are they showing up having not been seen for a while and their conditions are a little bit out of control? So we've got the work obviously is not done. We've got to continue to see, but I just wanted to throw out a host of different things that we'll continue to monitor and look at as time moves forward.
One additional thing we're looking at as part of our recovery framework is also there's been an impact on the healthcare sector itself, meaning that there have been some primary care physicians and other specialty practices that have actually closed down during COVID. It seems counterintuitive, but some of those providers have also been impacted. And so we're trying to understand what the scope and scale of that loss is, so that, as people, we have been encouraging people, if you needed a routine screening, if you needed a cancer screening or a prostate exam or a colonoscopy or something along those lines, you really, we wanted people to go in, but some people did delay those kinds of things. As they come back, we want to make sure that the healthcare sector is ready to receive them. And so one of the things we're doing as part of our recovery framework is really looking at trying to glean some data about what practices or specialties where there might actually be a reduced ability to provide service moving forward, and see what role the county can have. As you will recall, earlier in the pandemic, in partnership with the county council, we did offer a relief package to some of our healthcare providers to try and help them get through this event. But obviously now we need to go back and do some of the deeper dive and understand what the impact has been on the healthcare sector itself.
Got it. Thank you so much for your help.
Thank you, Rebecca. Next set of questions come from Tim Carney, Washington Examiner. Good afternoon, Tim.
Thank you. Thank you, Delegate Lutke, for joining us. Back in the summer, last summer, you were very critical of Governor Hogan for wanting to let Montgomery County private schools open. You said it would be very unsafe for them to open. The school year is coming to an end. There were fewer cases among in-person students per capita, it seems, than there was in the sort of general youth population. There was 1 hospitalization, 0 deaths. You said it would be unsafe for the private schools to open. They opened. It seems like it was safe. The public schools opened safely this spring. Were you wrong last summer about the safety of opening schools?
I said at the time, and I still believe, that political leaders should be taking their lead during a major global pandemic from health officials, from experts. Decisions about people's health and safety should not be made based on polling. They should be made based on the best information that we have at the time from health officials.
But wasn't that information wrong if the school year turned out to be safe?
I think suggesting that scientific advice is wrong based on anecdotal evidence without clear scientific studies is, a problem. I think, we don't know yet the full story of the spread of COVID, and we won't until public health officials have plenty of time to go back and analyze. But the idea that politicians should be making health choices for you is an idea that I just reject.
Well, I guess, Dr. Gales, you reacted to my last question there. I guess I'd like to know, what have you learned, what has the scientific community learned from last summer regarding the schools? Because it seemed to me that lots of us argued and fought and said the schools could be safe. They were safe. Have you learned a lesson from this school year about the decision-making process about COVID?
Well, thank you, Tim, for your question. We, as Delegate Lukey talked about, when we provide evidence, we provide guidance based upon the evidence and the criteria that we have in front of us at that time. I'll liken it to treating a patient in a clinical encounter. If a patient comes into your emergency room or your office, you treat based upon the information that you have in front of you at the time. And so going a year later and looking at the patient and then, asking, was that the right thing to do at the time? We don't have the luxury of doing that. We have to make decisions based upon the information, based upon the data, based upon the guidance that we have at that time. Now, studies have shown in different settings, in a host of different things, that different activities may have had a different impact over time as more information was gathered. I think there have been multiple points throughout the pandemic where guidance that was put forward when new data came forward pushed us in one direction or the other. And that's consistent when you look at the policies, excuse me, related to asymptomatic transmission, whether or not people should wear face coverings, whether or not physical distancing is different. And I can't go into specific details. As you know, we have an ongoing case related to the schools reopening, as related to the decision-making process in the fall. But as you also know, that information was made public, that we had multiple hundreds of investigations involving cases or potential cases in school settings that did require additional work and assistance. And we worked very closely with our partners in the non-public schools to help provide those investigations, help provide guidance around implementation of safe practices. And what's also important to emphasize is that we did that without state guidance for a long period of time, where we requested guidance from the state and we didn't have those details in place for a certain amount of time. Now, as we move forward, what I would like to emphasize, and I think is important, is we will continue those partnerships, again, with our non-public schools as well as our public schools, to implement guidance that we have that is evidence-based, it's clinically tested, and utilized from public health experts at the state, at the federal level, to implement those best practices to keep our students, to keep staff, and keep all of our residents safe.
Thank you.
Thank you, Tim. Next question comes from Steve Bonnell from Bethesda Beat. Hello, Steve.
Afternoon, everyone. Apologies if you went over this last week, but just for the residents of the county, as you know, we've recently fully reopened. What's the mask wearing policy going to be at county buildings, county courthouses, in the coming weeks? How is that going to play out, I guess?
I'm happy to answer that.
Ahead.
Right now our mask policy is that in county buildings, we still require masks for both our employees and our workers. In part, what we're doing right now is actually looking facility by facility to verify which facilities that actually needs to be in place for. And I would expect there's going to be a change in that policy over the coming weeks, whereby only unvaccinated visitors and employees are required to wear face coverings. What we're trying to do is, obviously, think about certain settings like our correctional facilities, our homeless shelters, or programs that are like summer camps, for example, where it's still required that you wear face coverings by the state. We obviously want to make sure that we've got the right practices in place in those places before we rescind the policy for other things. And so I would expect there's going to be a shift in that policy over the coming weeks. We've talked a lot about it. The data certainly supports a shift over the coming weeks. But we're just making sure that we can identify the facilities where we may need to maintain a policy because of the nature of the populations or visitors or residents that's being served by that program.
Then just on the unemployment news, this is probably for Delegate Lukey or the county executive. If now isn't the time to kind of end that extra supplemental money coming in, is it when the federal money goes to zero? I guess what would you two prefer, I guess, in terms of keeping that program going? If you just clarify that, I guess.
I mean, for my purposes, I would hope that we were tracking actually job recovery so that we actually, can see businesses reopening so we know there are jobs to go to. The problem with what the governors did, we know there aren't jobs to go to. And so, you can take people off unemployment, but it doesn't mean they're going to turn around and get employed. There are encouraging signs. I mean, if you look at some of the reports in the business journals, If you look, like I know I talked to folks in Montgomery counties, the liquor board, and they talked about approving, a high number of new liquor licenses, which means people are going to be reoccupying restaurant spaces and opening them up. But opening them up is the operative word. You get the liquor license, you've got to refurbish the facility and then bring people back. I hope September 6th is long enough. That gives us, 2-3 months to have a really strong job recovery. Maybe that gets it done. I hope that the Biden administration looks at data and makes this decision, because there's just no point in ending the benefit if people can't go to work. That's just not responsible.
Yeah, I'd echo that. I think, there is no reason, none whatsoever, to cut off these unemployment benefits before September 6th when they terminate by federal law. And, to cut them off early is irresponsible. The reality is the economy is starting to recover, but it's complicated. We have record inflation in some sectors. I mean, housing prices are out of control right now. So to introduce this uncertainty for the families that are having the most challenges recovering from the pandemic is just wrong.
Thank you, everyone.
Thank you, Steve. Next question comes from Suzanne Pollack from my MCM. Hello, Suzanne. Good afternoon.
Thank you. In light of what you're saying, is the county going to end or curtail its job freeze? Will you be hiring again, or is there any change to that?
Yeah, as we've made the decision to reopen, and remember, since none of us were future tellers, we could not predict when exactly we'd reopen. But as we're reopening now, we're beginning to hire. I know when I was in the library yesterday and had the opportunity to talk to the assistant director there are a lot of vacancies in the libraries, and there may be more when people have to make the decision, am I coming back to work? We have a very high number of employees who are in their 60s and older. And so we're going to see what that will add to the issue we already have, but we've got to bring people back to work. We didn't want to bring people back during the pandemic because it didn't make sense to hire people and then say, now go stay home because we're not ready to use you yet. So there wasn't a reason to do that. And, we didn't have a lot of notice as to when numbers would start collapsing to the point that we could actually open things up again. So it's a long way of saying, yeah, we're starting to rehire now for positions that we want to bring back. But we
Thanks.
we are examining our workplaces. The COVID's made us think about a lot of things. We have an enormous amount of teleworking we've done. And so we're taking, what's the saying, like, never, forego an opportunity presented by a crisis. It has left us in a position to think about some things that in the normal course of work we weren't thinking about. And so we're looking at how we reshape our workforce in the process of this.
Would that mean maybe getting rid of some buildings that you rent or use, or?
It's certainly a long-term possibility if we continue, and we plan on continuing a lot of teleworking. It was one of the things we learned, and obviously the private sector learned the same thing. I mean, Care First announced they weren't bringing anybody back. So, as we discovered that, you could actually do teleworking, and managers got over probably a years of bias against teleworking, we found that it actually worked pretty well for us. Now, there are things we have to learn. There are things we'd probably modify. We know that people want to be in sometime, if not all the time. So we're looking at, how we revise our system to account for that. But to the extent that we don't need space to rent, I don't anticipate renting space. And I'm sure you're going to see the same thing in the private sector. No one's going to bear more cost than they need to.
If I may add, as part of our government operations and services mission area of our recovery framework, we do have a space planning and design work group that is our Department of General Services actually is sort of coordinating that. But one of the things that we're really trying to do over the next several weeks is figure out what the new set point or the new expected level of services that our residents are going to need moving forward post-COVID. There have been some places where we've added online services that have been wildly popular and our residents want to utilize them. But we don't know is now that we're moving back to a hybrid of those services being provided online as well as in person, how many people are going to want to take advantage of each of those two different opportunities. And once we understand that tells us a lot about, okay, what do we need in terms of an in-office presence for various agencies across government. And as we understand that, we can understand, okay, do we do hoteling where people share spaces? Do we eliminate certain leased or owned properties? Do we shift the way that these are just done in general to accommodate what our residents really need? We're focusing on what the residents expect of our services and not the other way around.
Thank you.
Thank you, Dr. Stoddard. Thank you, Suzanne. And that was the last question request from members of the media on the chat. Reporters, going once, going twice. I think we're done. Thank you for joining us. Thank you to the participants. Thank you, Delegate Lutke, for joining us today. Have a great afternoon. Stay safe. We'll see you next time.
Thank you all.